Afternoon to everyone in the land of Zoom, and welcome to the Board of Health virtual meeting on Thursday, June 24th, scheduled for 4 p.m. My name is Thomas Corey. Present with me via Zoom is Michael Coughlin and Tess Curran, our agent for the board. Dr. Gagliardi is not present at the time. We are not in the City Council hearing chamber. All are participating remotely from locations in the known universe. Tess, if you'll please call the roll.
Thomas Corey,
Present.
Michael Coughlin.
Present.
Okay, pursuant to the open meeting law, any person may make an audio or video recording of this public meeting or may transmit the meeting through any medium. Attendees are therefore advised that such recordings or transmissions are being made, whether perceived or unperceived by those present, and are deemed acknowledged and permissible. The next item of business is the approval of the minutes from the meeting of Thursday, April 22nd. Are there any additions, deletions, or corrections to be made to the minutes of the meeting as printed?
I don't have any.
Okay, motion to accept?
Move to approve the minutes.
I'll second. Can we have a roll call?
Thomas Corey,
Yes.
Michael Coughlin.
Yes.
Next item on the agenda is a new business. We have an update on the COVID-19 vaccine and the tobacco control.
Thanks, Tom. So really, I just wanted to kind of go over some of the data and information that we're seeing, in the community. I'm wondering if I could maybe, I'm going to try and share my screen, Alex. So just as an FYI, just to show you, can you all see this?
Yes.
So the state, because we're one of the equity communities designated by the state as one of the 20 higher risk communities, we do get kind of an additional report that's sent out to me weekly via email, and it's also available online. And it really has a breakdown of kind of where we're at as a community and compared to the benchmarks of the state. So here you'll see that the state average for fully vaccinated is at 57.8% of the population, and Fall River here is at 42.7% of the population is fully vaccinated. And really what we're seeing is kind of week to week, we're about seeing a 2% increase each week. And however, our clinics are kind of unfortunately like pittering out in terms of numbers. We're solely doing mobile clinic operations as a city, and a number of the vendors in the community like Star, South Coast, Seven Hills are all doing mobile clinics. And we've had some success at some of the local grocery stores and other locations, but we're all seeing a decrease in overall numbers, and are seeing like less than 10 people vaccinated at each one of these mobile clinic opportunities. But we're continuing on, and CIC, the company that's working with the state, continues to have clinics at Kennedy Park on Fridays and Saturdays, and Lafayette Park on Sundays. And they're also continuing with that Market Basket program with the $25 gift card to Market Basket when people receive their first dose of a vaccine. So those are continuing. But I just kind of wanted to give you a frame of reference in terms of where we're at in terms of our numbers. I'm not sure if you can, can you see if there's is there a new
Yes.
slide? Mm-hmm. Okay.
Yeah.
And so I just wanted to show you, it does have a breakdown, by race and ethnicity. So, we're continuing to conduct outreach to specific populations, as well as the age groups. This is partially vaccinated, so I'm actually going to go to the fully vaccinated age. So you'll see again, we are below the state average for individuals 65 to 74, and then the 75 plus group. So our senior centers have reopened, so we do plan to have the public health nurses here go to the senior centers and try and talk to folks about vaccinations and then offer vaccines at the centers. So that will begin after the 4th of July. We'll be doing that. But we kind of across all benchmarks, we are unfortunately are behind the state average. So we do have some work to do. Hopefully some of these larger incentives like the Vax Millions or CIC is offering an iPad to people who receive a vaccine or to people who refer somebody to receive a vaccine at any of their clinics. So hopefully some of these incentives might get some additional folks vaccinated. But as we continue on, we're getting it's just getting more and more difficult because the folks who are not vaccinated, really have their beliefs about the vaccine. Does anybody have any questions on this data, or thoughts or considerations, or areas that you think might be beneficial for us to visit? Again, we've really tried to go to a number of locations, but we are open to any additional suggestions or considerations that people have, or concerns, or
No, you've covered the city with every possible place. So
yeah, and the
Yeah,
state. Oh, sorry. Go ahead.
While it's certainly disappointing to see us below the state average across the board like this, I don't think we're an outlier in comparison to the other equity communities and the cities like us, the Brocktons, New Bedfords, Lowes, and Lawrences. They're all showing similar numbers. Our experience is not unusual. I don't say that as a good thing. Just that we're doing what we can and getting the sorts of results that are typical for this type of a community.
mm-hmm.
Yeah, we do seem to be kind of right on par with a number of kind of in the middle of the pack in terms of the other equity communities and our percentage of people fully vaccinated.
Yeah.
And there is going to be another state opportunity. The state plans to bring a bus, similar to the train that was in other communities. So we will be a stop on that bus route, and that will be in July. And kind of floating around some ideas in terms of a location with high visibility and foot traffic.
The only other thing you might want to try, is really bringing up the variant and showing the numbers that you see in United Kingdom, where really the only people that are being hospitalized and dying are the unvaccinated, and how, this variant, the Delta variant, affects all ages, much more contagious. People are getting sick, and really, you're really not seeing it in the vaccinated. So, I think people when you bring it up in theory, they can have all kinds of reasons not to do it. But when you have practical comparison, you say, okay, here's what's going on over here. Vaccinated people, here's the percentage. Unvaccinated people, here's the percentage. Now try and argue with the logic. I think people may, because a lot of people are looking for hard evidence. They're not, for whatever reason, they don't trust the government or whatever the issue is. But when you show hard numbers like the numbers you have here, you can't argue with that number, and then you show those numbers. Here's what's actually happening in United Kingdom. And I think people can identify with a country like that because they're the most like us, economically and socially, everything else, healthcare, things like that. It's not, some country that's foreign to everyone. I think when you show them, here's what's going on over here in unvaccinated people, that may make a difference.
Yeah, I think that's a good point, and something that I can definitely relate to the folks in the community that are doing a lot of outreach. Does anybody else have any other thoughts or considerations? And I just wanted to let you know, this is data that was pulled last Wednesday. So they pull it on Wednesday, it's reported on Friday. So this is last week's data. It's the most up-to-date data that I have for this type of thing, but I did just want to make a note that this is the data as of last Wednesday.
Right.
Okay.
So we'll continue, we're kind of trying to use this to see where we need to be, or where, what pockets in the community we can do outreach to. We do try and coordinate with some of the organizations that are doing the community outreach. So Family Services is doing some outreach, as is Immigrants Assistance Center, which is based in New Bedford, but has a team here. The kind of state door knockers are also kind of aware of our numbers and are included in our community calls and are aware of our frvax.com website that we're driving traffic to and all of that. So, we're continuing to evaluate and try and to go where there is a need. And not in this data set, but in another report that the state does put out, they do break it down by zip code. I'm not going to go to that now because I didn't clean it up, and you have to scroll through all the zip codes in the state. But the 02723 and the 02724 zip codes do have the lowest vaccination rates in the community. And men in particular in the 02723 zip code are the lowest vaccination rates within that. I'm not sure if I had mentioned that on the last meeting or not, but that is something we had tried to kind of do some outreach to barbershops. From my office, we didn't have a lot of success, but there is a new initiative with the Biden administration that encourages and incentivizes barbershops, I believe. And you might know more about that program than I do. I'm not sure if you have any insight into that at all.
Not that one in particular, no.
Okay. Yeah, that just came out recently. So there might be a push to hopefully, get some more folks who frequent barbershops and feel comfortable in that environment too.
There's no question that men are more reluctant than women to get the shots.
Yeah, I think we unfortunately do see that kind of across the board in terms of health, promotion or prevention.
Yes, it's not unique to COVID-19.
But something that, we're trying to think creatively in terms of tackling and doing outreach to those groups.
Nobody's said anything about targeting bars, have they? I mean, that's. I think.
Well, that came up actually today on the outreach call, and is something that I think we might try and again evaluate and try and get even the younger population, or maybe certain demographics who are frequent a certain location to go there.
That would be a place where the target demographic congregates, the type of place.
Yeah.
I've never seen a vaccine clinic at a bar before, but it is the
yeah, I think I think it's definitely something that we should explore, and even today on our call, like things that we were talking about, things that maybe weren't working a month ago might work now. So we're kind of trying new things pretty consistently. We had sent a medic, one of the EMS medics, out with the door knockers to follow them to offer the vaccine, right on the spot. And that day we only got one individual, or I shouldn't say only, but we got one individual vaccinated. We would hoped that it would have a bigger impact, but we're thinking that we might try that again. It's been a month or two, so we'd like to see if that again makes it easier. That way people don't even have to leave their home. So that's something that we're going to be considering with that outreach team.
What are the case numbers like over the last few weeks in the city? I assume they're pretty low.
Yeah, they are pretty low. And Kathy from my office, I don't know whether, I'm gonna stop sharing my screen to see if I can pull up our numbers, because Kathy always sends them um, to us. So hold on one second.
And I think what happens once your case numbers go down, then people think they don't need to do it because they're fine. They're going to be fine.
Yeah, that's sort of what I was thinking, Dr. Gagliardi. And the other thought I had is that we're going to go through the summer months, and the case numbers are going to stay low. There won't be a lot of community transmission these next few months, but we might have a small surge in the fall.
Well,
if the variant takes hold.
with the Delta variant, that we will have a surge in the fall, and then everybody's going to get scared. All the unvaccinated are going to come rushing in looking for a vaccine.
Right.
So unfortunately, that's the way people are. So I don't know if you're really going to change that. I think people that will go out and do something proactively, you've reached. Other people need to see something or potentially have something bad happen.
Right.
Go out and do something. They go get a mammogram after their friend, dies of breast cancer.
So
Before that, they won't do it.
I agree with everything you just said. And the last thought I had was that we should be ready in the fall with a supply of vaccine, because there probably will be more demand for it.
Yeah. So I don't know if we should really burn through a lot of resources, to get one person. What are we doing to get one person vaccinated? Using up a lot of resources when I know everybody always thinks resources are unlimited, but in my world, they're not. But
Yeah, and we are kind of thinking internally how if it's a big lift to get a smaller number of people vaccinated, maybe rethinking that and having vaccine available at government center, certain days a week when we have the nurses.
Yeah. That's sort of
Yeah. So we may even shift away
At some point, I think it makes sense to do that.
from that, because we did have a clinic here one day in the lobby, and we vaccinated, I think, 25 people, and most of those were not, they weren't employees, so it was mostly outside people who were happened to be coming in today. And we have a lot of foot traffic in the area because of the post office, so with adequate signage we could maybe grab some of those folks.
So yeah, over the course of the summer and into the fall, if there were just a few locations that publicize that they'll be there at that time, so that there's always some availability.
Right. Yeah, I think that's kind of going to be where we go, and we don't really coordinate much with the pharmacies, but there are a number of pharmacies that do have it available as well. But in terms of our case counts, so as of yesterday, we had 14,289 total cases since last January, and really it's been one or two cases a day, pretty consistently from for the last several weeks, if not months or so, and we have in total since last January had 368 deaths related to COVID in the community. So our numbers with deaths are not upticking significantly, but sadly they do. We do see them coming across our board. So those are really the COVID updates and the vaccine updates. We do still have the Johnson & Johnson vaccine. Luckily, some of the inventory that we had was expiring, but with that extension, that kind of was helpful to us. And we do still have some Moderna, but most of the clinics that we're doing are J&J clinics, because again, we're in Price Rates parking lot or parking lots that it's simpler for us and for the folks to just have one and be fully immunized in 2 weeks out.
Agreed.
So that's really all I had on the vaccine front. I did just want to kind of, I know tobacco was on the agenda as well, and we do have the opening in the tobacco control position. So we have, that position has been posted for some time now. And we just recently had some applicants send their resume. So that kind of is ongoing, but just wanted to kind of announce that because prior to, we weren't seeing many applicants come through for that position.
Well, that's good that you got some applicants.
Yes, yeah.
What are the requirements for that kind of job?
You know, there's not necessarily kind of requirements in terms of an education level or previous skills, but you know, there's a lot of training kind of that we would do to gear somebody up. They do all the inspections and compliance checks in Fall River, as well as a number of the surrounding communities, because we're part of a Bristol, county collaborative. So you work with youth buyers and do, the licensing and inspections, and then it is a grant, so there's a component of coordinating and with the grant and doing budget reporting and kind of more office-based things as well.
There's no specific certification that's required.
Yeah. All right.
And
So Marilyn's helping you out, I understand?
Yes, Marilyn, she is our part-time inspector. So she is working a limited number of hours, and we are, so she is part-time. And those new state laws did change for some fining. So for sales to minors, first offense numbers have significantly gone up. I'm not sure if Seth had come on to speak of this, but they are. I have it somewhere here. They have gone up to I think it's $1,000 fine for a first offense. And this has been communicated to all the retailers, so that they are aware of all this. But it's $1,000. Sorry, violations. Yeah, for a first violation of a sale to minor, a fine of $1,000. A second violation within 36 months of the current violation is $2,000 fine, and then 3 or more within a 36-month period is a fine of $5,000. And those are all state, components. So those are state laws.
Do they get the fine and the invitation to visit with the board?
They would.
Or
Well,
they just,
this is
or
civil.
they're just fining now? Because
They would have to go-
before you'd get the $100 fine, on the second offense, you'd get the fine and an invitation to come and visit with us.
Let's see. I don't know that, Tom. It's a good question. Yeah. Well, the second violation does include the suspension of the permit.
And automatic suspension?
Doesn't say shall be issued in the tobacco sales
Maybe
permit.
maybe that requires a board action to suspend the license?
Well, in the past, we would, what's the applicant? The claimant would be invited to the board, and we would,
During my tenure, we did it too, Tom.
yeah, and then
That
we
was the
would,
most, that was our most significant piece of business.
yeah, for several years, it
Yeah.
kind of dried up the last 4 or 5 years.
Has it? Okay.
Yeah.
The FD, when the FDA came through town, we were only charging $100 fine, and I think they were charging $1,000 back then. And the word went through the retail community that, the thousand, not many of these small stores can afford too many $1,000 fines and have their permits suspended. So,
They cleaned up their act. Well, that's good.
mhm.
Yeah, Tom, I can get clarity on that for you, but I guess my thought would be with the suspension of the permit that might then triggered the involvement of the board, but I can follow up on that.
Okay,
for
just for
confirmation.
a point of information, I'm not looking forward to dragging people before the board. You know, we don't drag, we invite.
Yeah.
Okay, did we receive anything under citizens input?
No, we did not.
Okay, I guess the next item is confirm the date for the next meeting. Following our pattern, it would be the fourth Thursday of the month. That would be July 22nd. How's that sound?
Sounds good.
Okay,
Thursday, you mean?
That sounds fine, and I did want to just get a pulse on preference. You know, we can continue with the Zoom meetings because the legislature has extended that through, like, you can, like,
the end of March.
so we have more opportunities to do this. Or if there's a preference for the board to meet in person, you know, that's an option as well. But
Gee, there's no drive to City Hall, no drive home, nothing to feed the
I-
meters.
I mean, I can't say that I mind doing this.
As long as we're within the regulations, I
Right.
don't mind this, unless there's something terribly comes up that we really have to meet face to face.
Yeah, if something comes up that has a lot of public interest and a lot of people want to participate, then we probably would have to consider doing it in person.
All right, yeah, I'm good with this.
okay, great.
So July 22nd, 4 o'clock?
Yep,
All right, very good. Motion to adjourn?
So moved.
We need a roll call?
Thomas Corey,
Yes?
Michael Coughlin,
Yes.
Stephen Gagliardi.
yes.
Okay, thank you all for your time this afternoon. Have a wonderful rest of the day. Happy
Bye.
4th.
All right.
Bye, everyone.
Take